I'm also preparing myself for my own assessment, which is due next week. So what I'll be using will be a scissor. I'll be using my blunt forceps as a needle holder since I don't have one, and then I'll be using the tooth forceps as the ones that I'll be using to hold my patient's skin. And my patient will be the banana. So let's injure my patient. Give it a nice injury there. There we go. And then there's my needle and thread. So you'll hold your needle like that using your needle holders, in this case, which is my forceps. You hold it like that, then you place it the incision side, and the needle should form a 90-degree. I'm not sure if you can see it. It's supposed to be like that. Let me try move the patient as much as I can. There we go. It's supposed to be like that. Form a 90-degree angle, then you push down, then you just let it go in. You slowly push and push and push till it comes out on the other side like that. Yes, so avoid pulling from this side because it will cause more damage to the skin of the patient, which is what we're trying to reduce. The skin is already damaged, so others will use their forceps to put pressure on the wound like that and pull on the other side, but I prefer pushing the needle all the way in like that, all the way in, then pulling on the other side. So the thread will make less damage compared to when you're pulling the needle. So you just pull your thread, pull it in and in and in. There you go. You pull your thread in till you leave a smaller piece like that. So keep in mind, suturing is a very sterile procedure, so don't mind me as I'm doing this. I'm just doing it in a way that I'm trying to make sure you grasp as much information from this, or as much technique from this. So don't mind me that much. Just leave a small thread on the other end, and then let me just adjust my camera so you can see nicely as I tie. So when you tie, you put your needle holder like that. You start clockwise or anti-clockwise depending on how would you like to start. So you just, if for me I prefer starting clockwise, I'll go 1 2 3 clockwise, clamp on the short thread I've left on the other side, and pull like that, pull it out, and then ta, we have our first knot. Then the second time you'll twist it 2 times on your needle holder, but since I started clockwise, I'll go the opposite direction, which will be anti-clockwise. 1, then 2, clamp on the short strand and pull again. You pull, sometimes it sits like this, you just pull out the short strand and boom, now you have tied. Then the last time you'll just roll it over your needle holder once, opposite direction again, 1, then hold the smaller piece, pull it out, and boom, you have tied. So I know you can notice that my knot has moved away from the main thing, the main injury that I've made on my banana. It's because the skin, it's a bit soft, so it just, you know, moved across when I was tying. But on a normal human being skin, it will not do what it did now. But yeah, this is basically how you do it. Then afterwards you hold both ends, take your scissors and cut. So let's try it again, and hopefully this time it won't move away from the wound, so you can see exactly how it sits when you tie it properly. I'll try to go a bit deeper so that it doesn't tear the skin of my patient or the banana. So you put it 90 degrees like that again, and then you press and push. Oh gosh, I went too deep. Okay, you place it there and go to your patient like that. But if you're using the correct needle size, it won't be a problem. Mine, the needle is too big, so it needs a wound that is a bit bigger. So you just go like that. There we go. And then we go 1, 2, then 3, clamp and pull. First knot, then 1 and 2, no, 1 and 2, clamp and pull, then 1, clamp and pull. There you are, you got your knot. Then after that you hold both ends of your thread, cut. Therefore we get it. So let's do it one last time. On a clean surface, I'm cutting. There's my patient's wound. You hold your needle, create the 90-degree angle there, and push your needle gently. Then you came out on the other side. Then you go push, and then you pull from the other side. There you go. Leave a small thread like that. Then you go 1, 2, 3. Oops, went in. Okay, let's start again. Sometimes it does happen 90-degree there, pull, and sometimes it does happen, so don't be surprised. It does happen. Push, then pull the needle this side, leave a short strand, then 1, 2, 3, go there and pull out. First knot in 1, 2, 1, 2, clamp. So this time I'm being very gentle because I can see my banana is falling apart, so I'm very gentle on that. There we go. And then 1, clamp and pull. So the only tricky part of this is actually holding the needle holder. So if you're not yet used to holding your needle holder, it's going to be a bit of a challenge, you see. So there it is. My banana is all sewed up. I've stitched my baby.